without any further ado, let's get started and move on to our first session. So our first session, one of the senior social workers at the Gold Coast University Hospital will be speaking about navigating the healthcare sector. Andrea Patten is a social worker with over 25 years of experience across community, child protection and health services in Queensland, Western Australia and also the UK. With over 6 years of experience working in cancer care, including paediatric oncology, youth cancer, and now in radiation and oncology outpatients at the Gold Coast University Hospital. Andrea values the importance of people accessing information in the way that they need to inform their choices, decision-making and experiences whilst navigating their healthcare pathways. Welcome, Andrea.
Thank you, Erica. And thank you, Serge, for sharing your story like that. It's always such a privilege when people trust everyone around them to go into such details about your experiences with your own diagnosis, but also navigating the healthcare system. You almost covered some of the things that I have here as well, but thank you again. So I'm just going to share my screen. Hopefully this will work. So as Erica said, I work at the Gold Coast University Hospital and with all adult patients. So our youngest patient being 17 and the oldest that I've seen so far here has been 103 years. So the information that I'm providing to you today is quite generic. It covers the general themes of navigating your healthcare. And I recognise that everybody on this webinar today, maybe in different locations around Australia, you may be accessing your healthcare through public and private hospitals. So I can't give too much specific information, but there's some community services, there's some general principles about healthcare and everything that you as an individual, you have the right to know this information and to be able to access it to support yourself and your loved ones through their treatment journey. Another thing that's really important for me to note just before we start is often I do work with carers, sometimes more than patients, with the patient's consent. I have a number of patients who go, I just need to focus on my own health, but my partner, my son, my parent, they want to organise my life. So they're helping me navigate all of these external organisations that I need to sort out my finances and my work and, you know, the services and supports that we need at home. So it's important for people to tap into those loved ones or friends or carers around you if you're not feeling up to managing these things yourself at the point in time. Serge's example as well was that he and his wife were both accessing supports and looking into their own different needs and also talking with young people, teenagers, children. Again, it's quite a difficult conversation to have, but there are organisations to support that and something that you don't have to be responsible for absolutely everything when this is your health experience. Okay, so again, I'd just like to acknowledge the traditional custodians of the land and pay my respects to elders past, present and emerging. So patient rights, every patient, regardless of what healthcare service you're accessing, these are the foundational rights that we have here in Australia. You have rights of access to services and treatments that meet your needs. You have the right to receive safe and high quality healthcare that meets the national standards that again apply to all healthcare services in our country. And you have the right to be cared for in an environment that makes you feel safe and that is safe. You have the right to be respected and treated as an individual with dignity and always respect, and to have your culture, identity, beliefs and choices recognised and respected. You have a right to work in partnership with your healthcare providers. Yes, we do have many people that are experts in their fields, but you are the expert in your own life and your own body and your own needs. And so you have the rights to express those views, those wishes, and to ask those questions, to be curious and to want to understand more about what's being proposed to you as your treatment and health needs. You have the right to clear information about what your condition is, what the treatment plans are, what are the possible benefits and risks, so that you can provide informed consent. You have the rights to be informed about what the services are, what the treatment types are, what the waiting periods are, and if there's any costs associated with this as well. And you have the right to be given the different types of assistance so that you understand all of this information. We do a lot of work with interpreters. We do a lot of work with people who may have challenges with their cognition, to just try and make sure that everybody understands what is being proposed to them, so that it's informed consent you're providing for your own healthcare. You have a right to access your health information if you need that or want to understand more. And you have the right to be told if something has gone wrong during your healthcare, how it happened, how it may affect you, and what is being done to make it safe. With privacy, you have the right to have your personal privacy respected and to have your information about you kept secure and confidential. You also have the right, when you're conversing with any health professional, to say whether it's something that you don't want anyone else in your extended family or your next of kin or anyone else to know, if this is a conversation directly between you and your healthcare provider. Sometimes when people say that, often to say social workers, our response will be, if it's a scenario that you're putting to us where you or someone else may be at risk, then we can't always guarantee that confidentiality. But the majority of the time, you have that control around the right of your information and privacy there. And the last one, you have that right to provide feedback, compliment or complaint about the way that you have been treated, to share your concerns, and again, to be curious and keep asking those questions. And we really appreciate when people share their experience and participate in surveys or other activities to improve the quality of care and health service. I've been involved with consumer groups before, and the feedback and the service development that we can have when working with people that have this lived experience is really valuable to our health service. Okay, one of the big ones, and Serge did allude to this as well, when you have a diagnosis and you start treatment, what does this mean to your life? What does this mean to your ability to work to the level that you were at? What does this mean to any mortgage and other financial responsibilities that you have? Where do you even start? Often at that time of diagnosis, there's so much information. Trying to work out where to start can be quite overwhelming. And it can be, we just have to get through these practical tasks. We just have to work out, okay, diagnosis is this, treatment plan is this, it's starting on this date. Can I work? Can I not work? Do I know how I'm going to feel after I've started whatever my treatment is? What's that cycle going to look like? Am I coming so many days or so many weeks? How does all of this work? Over the past couple of years, many people have had to adapt to working from home. So I've had a number of people say there's a lot more flexibility now with that due to our current COVID environment. But it's important for you to take stock of what resources can you access so that you can at least get started. So I encourage people to talk with their current employer, look at what their leave entitlements are, sick leave, long service leave, do you have income protection, can you access your superannuation? A lot of people have had to access that over these past 18 months anyway, so that can be quite tricky. And depending on your age of stage of life, these again are all going to be quite different considerations for you. And then once we've worked through looking at all of those different factors, there is also that access to Centrelink through the Department of Human Services. For people that have never accessed Centrelink before, that can often be a challenge in itself. And all I can say is that everyone who is on this webinar right now, I'm assuming that you have quite a skill with your computer use and your technically savvy. So if you are looking at Centrelink, please just go online and go through all of their different resources that they have. They have this ability that you can put in your own details and it can spit some things out saying you might be eligible for this. Because the system now relies heavily on individual income and assets assessment as well as your health condition, I can only give really generic advice about what to look for if you're going down that Centrelink pathway. And I never make a guarantee to any of the people that I work directly with, because it is that application process, and we can help people navigate that as much as possible, obtain medical reports from our treating teams. But I'm not a financial planner and I've never worked for Centrelink, so we have to just do the best that we can to advocate for someone to access those resources if that's what they need. One of the other big ticket conversations that I have, again, it's something that as adults, it's something that, you know, generally it's a great idea for us all to have these practical documents in place, because unexpected accidents can happen to any of us at any time in our lives, and having a will or an enduring power of attorney or other important documents in place makes it easier for the loved ones around us to navigate our affairs at what is a very stressful time. So it does seem to be a common conversation that I have with people when they have a new or even an older diagnosis of cancer, but it's not just related to your diagnosis, it's part of organising our lives. So the Cancer Council has an excellent resource literally called Getting Your Affairs in Order, and it is on the Cancer Council website, and it is guiding you through what are all these different documents, what's the most important paperwork to have organised, and why do we need to do that? Making a will, do we do it ourselves with a will kit? Do we have a more complicated family or estate scenario that we need to get a solicitor involved? Do we do an enduring power of attorney, or do we want to have an advanced health directive if we have a will? You know, there's a whole lot of decision making involved in this process as well. What is the best form of paperwork that reflects the needs of your personal life and your situation? Again, there are resources available to support this. The Cancer Council has a pro bono program where if you meet the financial criteria that they have for that program, you can access a solicitor to help you prepare these documents. And they also, through the pro bono program, can provide financial advice. Because once again, as a social worker, I'm very clear that I'm not a financial planner. I can just point people in the right direction if that's the assistance that they need to navigate what do they access at what time, depending upon all the different resources that they have. So there's also public trustees and a range of different options, and people have their own experience or know others that have had an experience in preparing these documents as well. So we often go to those networks and check in with what we know. Oh, this worked well for my parents, or, you know, someone's had a challenging experience with this particular organisation, so we won't go there. I'm very happy just to have a will kit. So again, it's your personal choice, but it's just knowing that there's a range of things that are ideal to have prepared. I guess the enduring power of attorney is something that I do see come up in a hospital setting a lot, because that's a document that comes into play when you're not able to make those decisions for yourself. And it's identifying someone that you trust to either make those health or financial decisions for you for whatever that period of time is that you're not able to do that. We see that coming up and being an issue if that's not in place, often with financial situations. So say someone has had an accident and they're in our intensive care unit or just not able to articulate what's going on for them. And their enduring power of attorney, their nominated attorney, can then sort out their rent and their pay and their finances because they've got that authority, just to make sure that all of those things are accruing and sorting out in the background, and no debts are accruing and no enhanced financial toxicity. Because I know financial toxicity is often one of the big things that goes with a cancer diagnosis. There can often be a lot of unexpected costs, as well as a lot of that unexpected loss of income as well. So trying to have these things in order to reduce that financial toxicity is really important, if you can do that. So again, how to access help within all public health services. There would be social workers that you can access, and there are also social workers often in community health organisations and sometimes in non-government organisations as well. I know within the Gold Coast University Hospital, we have an advanced care planning team, and they specialise in just preparing those advanced care planning documents. The ones that we use here in Queensland are Advanced Health Directives, Statement of Choices, and the Enduring Power of Attorney are some of the primary ones. The Leukaemia Foundation and the Cancer Council and Lymphoma Australia are also those other places where you can go for further information and resources. I also did just want to touch again on what Serge said at the beginning about Googling. As a health professional, Dr. Google, everybody has a love and hate relationship with Dr. Google. So I do recommend going to the websites that do have some fairly solid and legitimate advice on it, such as Leukaemia Foundation, Cancer Council, Lymphoma Australia, as those resources are really targeted for people here in Australia, all trying to navigate their needs across these diagnoses and the healthcare system in our community. Dr. Google can have a lot of challenges, I think, and each of you has your own individual story, and we need to just make sure that we're providing you with the information that meets your needs at the stage of life that you're at. Now, that is a really quick synopsis of some of the core areas of navigating the health system and how you can tap into it within your local health service, but also in community organisations. Are there any questions?
Excellent. Thank you so much, Andrea.
Okay.
I'm just having a quick look at the chat function. So Debbie has commented and said that I'm concerned when you're a patient and there is no centralised place for you to get referrals to see health professionals that you need to. It's been exhausting for me to attempt to do this myself. What would be your advice to someone like this? I think, unfortunately, not all patients have access to someone as wonderful as you who is able to facilitate all of this sort of thing. But what would you specifically say in this sort of scenario?
Yeah, I think that is a tricky one because every health service is quite unique in what that setup is. And as Erica would know, I work very closely. We have an amazing team of specialist cancer nurses here at Gold Coast University Hospital, and Erica is one of our haematology CMCs in her spare time. So we work really closely together as a partnership. So really always from my perspective, I think as a patient in any health service, ask for a key contact person. Who is that main person that you can ask any questions of? The way that we work here is to try and identify one key contact person who will take all of the questions, but know that they don't have to answer all of those questions, that they can then come to the social worker or the physio or to the doctor or whoever it is that is the most appropriate person to respond to those needs identified. I do hope that everybody has one core contact person within your treatment, at least, that you know that you can just ask that question. For some people, I am aware that can be your GP, and it may be community supports again that you're going back to. again, my understanding, even with calling Cancer Council, if you have questions that you're finding you're not getting those answers to within your health service, I have had a lot of people have positive experiences with calling Cancer Council and just asking those questions, because that's also within your local state, asking the questions and then helping navigate to where is the next resource that you can tap into that way.
And I think that that's probably an excellent point as well too. I think, yes, as you say, all health services are very, very different. But then I think that's exactly where organisations like Cancer Council and also like us, like Lymphoma Australia, have that ability. We have the nurse support line as well too. So patients can call if you're uncertain and you've got a problem and you're not sure who to speak to about it, but you know that you need to see someone to try and manage it. You can call and speak to one of our nursing team as well too, to try and point you in the right direction and get you all organised in that sort of respect.
And just one other thing I wanted to say, it doesn't matter whether you are a health professional or how highly educated or anything else you are. When you get a diagnosis like this and we fall into that patient role, it can always be overwhelming. It can always be challenging. So you might be the strongest advocate in your own life or in your family members' lives and everything else. But when this is your body and this is your health, it's quite a different place to be in. So the other thing I would always encourage you to have someone with you when you go to appointments, have someone taking the notes, writing the questions, helping you record all those appointments. Just there's so much to retain. And I don't think any of us can actually do that when we're sitting in that patient seat. It's a massive shift for you. And whilst our role is to be empowering you, there's so many different things, and it can be quite overwhelming. So don't be hard on yourself if it is too much at any stage in this. Hopefully, you do have some support people around you who can assist you just to feel more confident in that as well.
I completely agree with you as well too. And someone said to me the other day, and this has really stuck with me as well too, no one is a bigger advocate for themselves than themselves and their family as well too. So I think that really, really echoes through here as well too. There's another question that's come through as well too, Andrea. When you're on a clinical trial, do you have the rights to your results as you're being treated? I think that's probably a little bit tricky to answer and would depend on the clinical trial, but do you have anything that you would like to say about that?
I would say that you would have to ask as you are going, well, ideally something that you would ask before you go into the trial, but then I think it's also something that you just need to keep asking throughout that process of the trial. What information are you going to get? Particularly if you're then going back to your original treating team or healthcare environment, what is that handover? What do you get to find out from your experiences on the trial?
Yeah, I agree. I think that's pretty solid advice. Here you go. And people are giving you a shout out now as well too. Social workers are valuable members of healthcare teams for emotional support as well as much advice. So thank you, Andrea. All right. I don't think there's any more questions that have come through, and I think we'll probably move on to the next session. So thank you very much, Andrea. We very much appreciate your time.
Thank you.
Thank you.